to the Trust the Plan podcast. I'm Nick.
And I'm Preston.
Preston, summer is cruising by quickly. It's almost football season.
Yeah,
That's
true.
Do you take any summer trips this year? Anything fun?
Yeah, Natasha and I went to Charleston, which was fun. It was just a week kind of touring the town, getting our steps in. And actually, the weekend before that, we went and saw Natasha's best friend had a baby. So we went to visit the baby in Illinois, so that was cool.
So you went to Charleston to get your steps in.
We got our steps in as a result of going to Charleston.
Gotcha. Because you could just walk around town here.
Right.
Okay. All right. So today we're talking about continuing care retirement communities. And before you say to yourself, I'm too young to talk about that, just keep this in mind for the future, though. Don't turn it off, because you're going to want to know of this info for 20 years from now for yourself or whatnot. So this is an article from the Wall Street Journal talking about continuing care retirement communities. This is a place where you go, you put a big down payment down. So imagine you sell your home and use that money for your down payment into this community. And at the community, they offer independent living. So it could be husband and wife, or just a single person choosing, 1 bedroom, 2 bedrooms. You have your own kitchen, right? You can go downstairs and eat in the cafeteria, or you can just stay in your room. You have everything you need, and you're living independent, okay?
Yep.
And you don't need any care, so to speak. And then if your health deteriorates, you can stay in this community and switch to a different room where they offer assisted living, where there's more help, right? And by the way, you still have a rent payment. So you pay the big downstroke, and then you're paying rent every month for your room and board. And if you need assisted living, which is some extra care, you pay additionally for that as well. And then the third level is skilled care, nursing care, or memory care. Okay. Right. Again, this is the same community, right? The same campus, different room, more care needed. Okay. And the idea is that you're never going to be kicked out. You're never going to be kicked out because you put in this big downstroke.
Right. Yeah. I mean, it seems like a fair deal to me. You commit to living to this place. You find the place you want to finish your life in, and you just continue down the line.
Yeah. So it offers that comfort. There's another way where you don't have to pay all the big money up front, but you go to independent living. Maybe they have assisted living and skilled nursing care as well. Maybe not. But because you're not putting in this big downstroke, you probably have a higher rent payment each month. Okay, so those are kind of the two paths you can choose. The third would be, I guess, if you just go right, you have an event like a stroke or something happens, and you go right into skilled care from the hospital, and you have to have long-term care insurance, spend down, or have Medicaid.
Right.
Okay, but today we're talking about the senior facilities, the continuing care retirement communities. From the Wall Street Journal article, okay, we're learning that there are over 2,000 facilities like this across the country. And sadly, 16 of them in the last 5 years have gone bankrupt. And so this is the key here that I want you to remember, is that most of these places are financially stable, but there have been 16 bankruptcies. And so remember, you sold your house, turned over all the money to the facility, they file for bankruptcy, and now all that money, well, let's say most of that money is gone.
Yeah.
It's like an investment gone wrong.
Right.
And so not only, do you have to deal with the courts and deal with a new company coming in and purchasing the facility, but you're probably going to get a third or less of that money back, and now we have to start over again.
Right. And the initial plan when you first went in, the initial agreement you came to was when you pass, there's going to be a big chunk of your down payment left over to go to your heirs.
That's right. So in the Wall Street Journal case, the deal with this company called Harborside, which was the one of them that went bankrupt. So the example here, the case study was an 89-year-old woman who put down $945,000, and this is on the East Coast. It was a pretty nice place. But the understanding was that you're supposed to receive 75% of your money back when you move out or when you die, okay? and they're going to get less than 1/3 back, and it's still uncertain at this point. Okay, so there's been 1,000 families tied to these 16 bankruptcies. Okay, and 212 of them were with this Harborside, but we're talking about $190 million that most of that could be gone, and so it's really sad. And you know, I think when we're entering into this type of transaction, right, we want to be happy with the facility, happy with the people, happy with the care, but also we want to be understanding their finances, right?
Right.
What is the risk that we could be in a Harborside situation? And in the article, they blamed it on not enough new people signing up. But at Harborside, right, there's a large monthly rent as well. The business model should work based on just the monthly rent. They shouldn't be relying on these big downstrokes. Otherwise, it's a Ponzi scheme.
Right. Yeah, that was my exact thought too, is if you're paying this big monthly rent and also putting down the big down payment with the understanding the down payment, or at least a chunk of it, is going to come back when you pass, this company cannot be relying on these big down payments.
That's right. So the one that we see our clients going to here in Southeast Michigan in Novi is Fox Run. So here's what I just looked up Fox Run's website today, and I'm not sure what their finances look like, but I know they've been around for over 20 years, and people that we have worked with have passed away and got their money back. So I'm not endorsing Fox Run. I'm just saying here's an example of what the finances look like from the client perspective. So if you want a 2-bedroom place, and maybe you're married, maybe you're single, but it's nice to have some extra space, okay? Because you don't have a basement, right? You don't have a garage, right? Where you're gonna put your extra stuff. It's nice to have a second room.
Right.
So that's $246,000 is your downstroke. So much different than this Harborside East Coast example. $246,000, and most homes would sell for more than that. So you sell your house, you turn over a chunk of it to Fox Run, and they say 90% refundable. Okay.
Yeah.
So that's pretty good. Even better than the 75%. And then for a 2-bedroom apartment, you're looking at between $3,000 and $3,400 a month. That's the current pricing. So, you know, you're if your house is paid off, you don't have a mortgage, but you do have property taxes and insurance. Maybe that's like $1,000 a month or less. Well, now we have to pay more for $3,000 to $3,400 a month. Okay, and so we have to, you know, build this into the plan. The other people that sell their house and keep the full proceeds, they might have a rent payment of $5,000, $6,000, $7,000 a month for independent living. So they go from having no mortgage and no rent to a maybe $6,000 a month payment, but you get to keep the full house proceeds. So that money goes into your brokerage account, and it can be used to help pay that rent.
Right. Yeah. Doing it that second way, not that I'm endorsing one way over the other, but doing it the second way allows you to visually see, okay, these are my home proceeds. This is how many years it's going to cover that rent payment.
Exactly. And so the downside with that strategy is that you don't have the continuing care promise.
Right.
Okay. As long as they're in business.
Right.
So if you have a family member, or if you're thinking about what your portfolio can support in terms of independent living, continuing care, reach out to us at peakwm.com and get your second opinion.